and share the screen, and because I made a fun PowerPoint for y'all. And y'all don't be intimidated. Okay, let me start my slideshow real quick, and then we'll get going. There we go. Okay, cool. So guys, I am so excited to share this with you guys. So if y'all know me, I'm Heather King. I'm a nurse practitioner and a senior gold ambassador with Plexus. And I am sharing this information. I actually went to a continuing education seminar about this a couple weeks ago. It was a 6-hour seminar that I'm kind of consolidating and breaking down for you guys. Because I really feel like it applies to what we do and what we share. So I did put the disclaimer on here that this training is brought to you guys by me, an independent Plexus ambassador, and not sponsored by Plexus, and that we do not claim to cure, treat, or prevent any disease. And as we get into this, guys, I really am not going to be talking about our products at all. I'm going to be talking about our body and how it works and how chronic disease, what it stems from. And you guys know about our products and how they work. And so you guys will be able to deduce, our products focus on gut health, inflammation, and blood sugar stability. So, you can make your own deductions from there. Okay. So objections, basically, we're going to identify the connection between inflammation and autoimmune diseases. We're going to look at current evidence linking gut health to autoimmune diseases. Specifically, we're going to look at type 1 diabetes, multiple sclerosis, and Sjogren's syndrome. We're going to look at the relationship between gut health, inflammation, immunity, and chronic disease. Explore how the gut microbiome is related to neurodegenerative diseases such as Alzheimer's and Parkinson's. We're going to look how stress, diet, and age affects our immune function, and how our diet influences our gut microbiome, and how dietary modifications can change your gut microbiota and reduce inflammation, and look at the latest on probiotics, inflammation, and immune response. Okay, so to start out, let's talk about inflammation. So inflammation literally means to basically set on fire. Okay, and inflammation is really a protective response in our body. Basically, your body has inflammation if it sees that a cell is being injured and it's trying to eliminate the cause of that cell injury. It can remove necrotic cells in tissue, which are basically dead cells in tissue, and it initiates the process of repair. However, some components of inflammation that are capable of destroying those harmful microbes can also injure normal tissue around where those negative inflammatory triggers are. And if inflammation lasts too long or is more severe, it can potentially be detrimental and harmful to our bodies. So the most common symptoms of inflammation, of course, are going to be heat, redness, swelling, pain, and loss of function. And I'm trying to go through this fast because, guys, I have about 60 slides here. And anyway, I'm not going to go too much into detail. I just want to give you a big picture about how all of these things connect, okay? And I value your time too. So inflammation is definitely linked to a lot of chronic health issues, cardiovascular diseases, Alzheimer's, diabetes, arthritis, autoimmune issues, neurological diseases, pulmonary diseases, allergy, asthma issues, and cancer. And there is a difference between acute versus chronic inflammation, like I was talking about earlier. So acute inflammation really has more to do with healing. So if you have a cut, some kind of trauma, a sprain, an allergic reaction, a burn, and an infection, our immune system is designed to help heal our body. And so it's designed to help take care of that and for our body to be able to heal. So that's not a bad thing. However, when you're dealing with chronic inflammation, that's when you end up with progressive destruction, and you end up with issues like cardiovascular diseases, rheumatoid arthritis, autoimmune issues, Alzheimer's, cancer, autism, those sorts of things, okay? This is taking a look at inflammation and autoimmune disease. So basically, there are 3 components that are going to contribute to autoimmune disease. There's definitely a genetic component. I put some certain genes that contribute to autoimmune diseases up there. Also, of course, environment. If you're sick with virus or bacterial infection, sometimes those things can trigger an autoimmune response. Having emotional stress, medications that you would take, metals and chemicals, things that we're exposed to in our environment can trigger inflammation. And of course, gut dysbiosis. What that means is unhealthy, imbalanced gut flora triggers an immune response and can lead to autoimmune disease. So what autoimmune disease is, to understand that, you need to understand basically our cells have markers on them, and our cells in our body should have what you call a self marker, which basically means that those are things that your immune system should not attack. They are considered its friend, it's tolerated by the immune system. There are organs that we use to function each day. An antigen is basically a germ, so like a bacteria or a virus, that the immune system recognizes as not self and treats as a foe and tries to attack, okay? So that's how your immune system works. It has markers that it sees as good and bad, self or non-self. Basically, it should not attack self markers, and it should attack the antigens to help keep you healthy. So what autoimmunity is basically the failure of the organism in recognizing its own parts as non-self. And so it allows an immune response against its own cells and tissues. And any disease that results from such that an immune response is termed an autoimmune disease. Auto means self. And so it's caused by a lack of germ development. I know it can get kind of complicated, but basically it's an immune response against your own cells and tissue. And I like this picture here. It talks about normal immune response against bacteria. You see those little antibodies. Antibodies are things that your body uses to fight off antigens, which are germs. And so you see in an autoimmune disorder, the antigens have the antibodies have attached to our normal body tissues, and they shouldn't do that, okay? So they've gotten there and they shouldn't have. And because those antibodies are attached to those healthy body tissues, our immune system starts attacking our normal healthy body tissue. There are over 100 autoimmune diseases out there. So, of course, we're familiar with a lot of them. I'm sure we have a lot of friends and family who deal with them. So, thyroiditis, inflammation of the thyroid, Hashimoto's hypothyroidism, Graves' disease, those are autoimmune issues where the thyroid is being attacked. With your bones, you can have rheumatoid arthritis, spondylitis, and then rheumatica, like rheumatic arthritis, that sort of thing. With muscles, muscular dystrophy, and fibromyalgia, where your body is attacking the muscles. With your skin, we'll see psoriasis, vitiligo, which is basically a loss of color in the skin. So you have white patches, eczema, and scleroderma. Those are just some autoimmune skin diseases. With the lungs, fibromyalgia and granulomatosis can affect the lungs. With nerves, you can deal with neuropathy. With our GI tract, celiac, Crohn's, ulcerative colitis, and diabetes can all have an effect on our GI tract. With blood, you're looking at lupus. And with the brain, multiple sclerosis, Guillain-Barré syndrome, and autism. These are all considered some autoimmune illnesses that our body can, that we see so many people that we know who are affected from, okay? So risk factors for an autoimmune disease. Females are at higher risk for having an autoimmune illness. Age, and it depends on the autoimmune illness. There are actually some where you can develop at a younger age, but in general, most people it's going to be older. Ethnicity also depends on the autoimmune issue that you're dealing with, but there are certain autoimmune issues that are more common in white versus African American versus Asian or Hispanic populations. Family history, which goes along with the genetic role, and exposure to environmental agents that we had talked about earlier. Those can be stressors on our body and trigger inflammation. And of course, previous infection, whether it's viral or bacterial. And we talked about how the antibodies can get on our healthy tissue, and your body ends up creating an immune response against that healthy tissue. So aging and the immune system, we're just going to talk in general about our immune system, and of course with elderly. Our elderly people we know have a higher risk of viral illnesses and infectious diseases such as pneumonia and flu. They're still the fourth most common cause of death among the elderly. And these immune responses can exacerbate inflammation in the body. So cancer, cardiovascular disease, stroke, Alzheimer's, dementia, all of those things are linked to inflammation. During a regular, let me see if I can go back. There we go. During a regular flu season, about 90% of the deaths occur in people over age 65 because they do have less of an immune response than we do. And this talks about at the bottom how you can have reactivation of latent viruses such as the varicella zoster virus, which will cause shingles and chronic neuralgia, which is nerve inflammation and pain. And so this just talks about how as you age, your immune system is going to decrease in how well it works. So also we've seen that reduced bacterial diversity in the gut, which means that you do not have a wide variety of bacteria, gut flora in your GI tract, has been correlated with C. diff, diarrhea, which is basically an infection in your GI tract. This also talks about how an aging immune response fails to maintain full tolerance of self-antigens. So that means that your body, it doesn't recognize self versus non-self. So that's why there's an increased incident of autoimmune diseases as you get older. And of course, other diseases such as arteriosclerosis, dementia, cancer. There's definitely a link between inflammation and aging of the tissues. So I also wanted to talk about the stress connection. Basically, our hypothalamic pituitary adrenal axis causes increased cortisol, which is a hormone, and that directly leads to increased inflammation. And our central nervous system communicates along pathways to the intestines, and the muscle layers and the mucosa and motility, which means how things move, the immunity in your gut, permeability, which means how things move through the GI tract that shouldn't, and also secretion of mucus in the GI tract. So sorry, I'm trying to like not make this complicated, and some of it is a little bit, but anyway, just know that stress, there is a connection between your brain and your GI tract, and your brain communicates to your GI tract. And so when you have stress, your hormone levels can be off, and that can affect the communication from your brain to your GI tract. That's kind of a basic way to put that. Chronic stress, studies show that that can lead to increased heart rate and blood pressure, and definitely can affect your immune processes. So if you deal with chronic stress, you can have elevated corticosteroids, which that's going to suppress your immune response. And with your GI tract, specifically, chronic stress can have a big effect on that. Typically, you have your fight or flight response that will take over. And this talks about, I talked a minute ago about how there is a connection between your gut and your brain. And so if your vagus nerve is stimulated in your GI tract, that actually will decrease gastric motility, so things won't go through the GI tract as quickly as possible, and that's going to lead to irritable bowel syndrome, dyspepsia, which is acid reflux, gastritis, which basically means increased acid production in the stomach, and constipation. Or if the parasympathetic neurons are being affected, you would have increased colonic motility, which is basically going to lead to other IBS issues and diarrhea. Okay, so hopefully that's not too complicated and kind of helps you understand how stress plays a role in our immune response and our gut health. So here we go. It's kind of a good picture of what I was just talking about the brain-gut connection. Let me see if I have a question. So he has a chat on here. Oh, somebody has no volume. Can y'all hear me okay? If you can hear me okay, I mean, somebody like give me a thumbs up.
I can hear you.
Okay, cool deal, thanks. Okay, I just wanted to make sure. I don't know why somebody doesn't have volume. But, okay, so how stress affects the GI tract. This is a picture of what I was talking about, how your brain communicates with your GI tract. You have your gut flora, and how if you have dysregulation of that, then basically you're going to end up with GI symptoms such as acid reflux, ulcers in the stomach from increased acid production, things aren't moving as well as they should, an inflammatory bowel disease, and even food allergies can be linked to the stress and how that plays a role in your GI tract. So I wanted to talk a little bit about our microbiota, which is basically the flora in our GI tract, okay? So, sorry, I'm trying to check chats. Okay, so some bacteria in our GI tract help protect us from other pathogens, and it takes up space so that other bacteria can't take up residence. So basically there needs to be a balance where we have a diverse amount of healthy flora to help keep us healthy. Also bacteria, that flora is responsible for helping us to absorb nutrients, and changes in their microbiome, which are that flora in the GI tract, is associated with a number of diseases such as Crohn's, bacterial vaginosis, and obesity. And we're going to look at those as we go on here. Let's see. And this is really neat too. This talks just about functions of our gut microbiome, all that flora in our GI tract. It's so cool. I love this picture of the tree, and you can see how our gut flora is linked to so many other health issues that we deal with. So obesity, adiposity, which means your fat tissue and where things are being stored, diabetes, and even if you don't have diabetes, you can still be dealing with insulin resistance. It can trigger systemic inflammation, endotoxemia, and septicemia. What that means is that toxins can be released from the GI tract when they shouldn't. Septicemia is actually a really big deal. If you're septic, that means you actually have an infection in your bloodstream, which can be deadly. Metabolic syndrome, which is related to obesity and has to do with your cholesterol levels and increased risk for diabetes, that sort of thing. Rheumatoid arthritis, asthma, cardiovascular diseases, hypertension, endocrine imbalance, colorectal cancers, diarrhea, constipation, celiac, gastroenteritis, which is inflammation of the GI tract, irritable bowel syndrome, ulcerative colitis, Crohn's disease, like all of that is linked to your gut health, okay? And we talked about the gut-brain axis a little bit, which how basically your GI tract and your brain are connected and communicate to each other. Of course, there's a role with metabolism, so that's why it's important with obesity. And of course, it is related, our gut microbiome is there to help protect us and there for immune system development, okay? And obviously what you have in your gut can make a difference whether it's harmful or helpful as far as that immune response goes. So we're going to talk a little bit about leaky gut syndrome, and what that means is basically there are junctions between, basically there's supposed to be tight junctions, okay? So in your intestines there are cells and they should fit very, very close together, and there should not be space in between them for things to pass through into the bloodstream, okay? So what the function of those is to keep out things like toxins, microbes, and undigested food particles from getting into the bloodstream and getting to other places in your body that you don't want them to go. This is a picture of what that looks like. So you can see you have toxins, microorganisms, certain food particles, and you can see here when those junctions become inflamed, then they become leaky. And so those sort of particles can actually flow through from the GI tract into the bloodstream, okay? And then you have these immune responses, IgG, IgA, B and T cell. Those are basically different types of cells, and I don't want to get too complicated with that, but basically they are immune responses, okay? And if you have those immune responses, what that can lead to is nutrient malabsorption, autoimmune issues, food intolerance, blood-brain barrier breach, which basically means that it can affect your central nervous system. We talked about that, gut-brain axis, and systemic inflammation. That means inflammation throughout the body, okay? So this is huge, and this is definitely a real thing where you have things that you're putting into your body, whether it's foods or antibiotics or whatever it may be, your flora in your GI tract isn't diverse or balanced well enough. You have inflammation, your gut gets leaky, and those things that are not supposed to get into your bloodstream, those toxins, they do, and then it can lead to all these other issues, okay? And then this is just another picture of that, of the leaky gut syndrome cycle, where you have intestinal inflammation of the gut lining, then you have nutrient malabsorption. It talks about vitamin D and magnesium there. Then you have an immune response. So then you end up with GI issues like irritable bowel syndrome or Crohn's disease, those sort of things. You can have food intolerances, which means when you eat a certain food, that will flare up that inflammation. Then that leads to autoimmune diseases, and it's just this horrible cycle, okay? So causes of leaky gut, definitely poor diet, stress that can cause inflammation. We talked about that. Toxin overloads of things that you're putting into your body, bacterial imbalance. So of course, people if they don't have the diverse flora in their GI tract, and the most common components of food that can damage your intestinal lining are the proteins found in unsprouted grains, sugar. We know how bad that is for us as far as feeding that candida in our gut, GMOs, which are genetically modified organisms, and conventional dairy, okay? And when I'm talking about these things, guys, it doesn't mean like, oh, you can't have milk anymore, or you can't have anything with sugar. It's just like everything in moderation. It's just things to be aware of when you're thinking about making healthy choices, especially if you or someone you know is dealing with leaky gut syndrome or autoimmune issues, okay? So we're going to talk a little bit about probiotics. So I think we might all know, we should know, that probiotics are basically live microorganisms that when administered in an adequate amount, they can basically have a healthy benefit for the host, which would be the person taking them. So lactobacillus and bifidobacterium species are two common ones. And then the Saccharomyces boulardii is a healthy yeast. And that is actually very good for your GI tract. And I'll tell you, like, research into probiotics has really, really, really increased over really since like the year 2000, over the last 15 years or so. But there are definitely gaps between certain products and then what research has shown to be effective and what's being claimed in the marketplace. And I think that we see that. I think there's probably a lot of us who have tried other brands of probiotics and did not have the same results as with our current probiotic that we are taking. And I also think it's interesting, if you look at the current probiotic that we are all taking, that we do have those species in our probiotic. So what you want to look for, of course, is the brand quality, the CFU count, which is colony formulating units, strain diversity. Are there a lot of different flora? Okay, well, I think ours has 5, which is awesome. Survivability. That means, is it going to get into the GI tract and actually survive that acid in the stomach to get into the intestines where it needs to work? The answer with ours is yes, it does. And of course, research that backs up how those flora can affect like basically research that shows how those strains can help improve your immune response, okay? So I did want to talk a little bit about GMOs, which I find really interesting just because these are things that can affect your gut health. So GMOs are genetically modified organisms. They have been in the market since 1996, so over 20 years now. Some common genetically modified foods are soy, corn, canola, rice, and cottonseed oil. 10% of the world's croplands were planted with genetically modified crops in 2010. And y'all, this is crazy. In the US in 2010, 93% of the planted areas for soybeans, 93% of cotton, 86% of corn, and 95% of the sugar beet were genetically modified varieties. What that means, guys, is that it can be hard to find things in the US as far as things that you're ingesting and using for cooking that are not genetically modified. And it can definitely play a role in your gut flora, okay? So tips for avoiding genetically modified foods. Basically, if you buy organic, then it's not going to be genetically modified. So you'd want to look for that USDA organic label. And you also want to look for the non-GMO label. So it'll have that cute little picture with the butterfly on it. And there are some at-risk foods that you would want to avoid, such as corn, soy, canola, cotton, and sugar, anything not listed as 100% cane sugar. And I get it, y'all, it's hard and to be that picky with looking at labels, but it is important to look at labels. And I know it's a lot more expensive to do that as well. But if you know someone who's really struggling with gut health and their imbalance of gut flora, that may be something that could be helpful for them, okay? And then this talks about a non-inflammatory diet, things that you would take in that actually would help fight off inflammation. So oily fishes, such as salmon, fruits and veggies, of course we know, nuts like almonds, beans, olive oil, onions, and things with lots of fiber like leafy green vegetables. Those are all things that can fight off inflammation in our body. So of course, nutrition is key. We love our supplements, and we know that they are definitely tools to help us with healthy lifestyle choices. But we've got to do our part too and continue to make those healthy choices. And of course, foods that will trigger inflammation are going to be processed foods, sodas, fried foods, fatty foods, those sort of things. So, and here it talks about it again. Foods that are high in pesticides. So if you have fruits or veggies that are not organic, you're not washing them well before eating them, if there's any sort of heavy metals in them or additives, those are things that can suppress your immune response. And I love, love, love this picture that talks about the doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition. Because, I think with health, as a nurse practitioner, I love focusing on prevention over prescription. There's definitely times where I need to prescribe medication for people, and there are so many medications out there that are saving lives, and it's awesome. But if we can teach people to take control over their health and to, basically be responsible and take it into their own hands to, have that control to be able to prevent the chronic issues that they're dealing with, that's huge. And that's a lot of what we do with sharing our products and health tips with other people, is to be able to help them with their overall health and prevention of chronic issues, okay? So I'm going to start going into basically some specific inflammatory diseases and how our gut can affect those. We're going to be talking about rheumatic disease. So 75% of patients with new onset RA, which is rheumatoid arthritis, had Provotella copri in their intestinal microbiota. 37.5% of psoriatic arthritic patients had the Provotella copri in their gut, compared to just 21.4% of healthy controls. And juvenile idiopathic arthritis, there was an increased intestinal permeability along with gastrointestinal symptoms with those children, okay? So you can see that an imbalance of the gut flora directly contributed to those autoimmune inflammatory diseases. We're going to be looking at type 1 diabetes. So type 1 diabetes is an autoimmune disease. Typically, it develops in childhood. They consider it juvenile onset diabetes. However, it can develop in your 20s, 30s. You know, it can develop later in life. I've known people 40s, 50s who develop type 1 diabetes. And what happens is basically your immune system attacks your pancreas. Your pancreas produces insulin for your body that you have to live. That's what keeps your blood sugar under control. And if your blood sugar gets too high, it can cause a lot of damage to your kidneys and your nerves, your entire body, okay? So type 1 diabetes is definitely life-threatening. And as far as prevalence, it is greater in men versus women. There are definitely alterations in the gut microbiome where you'll see an increased susceptibility for someone to get type 1 diabetes. And vitamin D deficiency is directly linked to type 1 diabetes as well. With vitamin D deficiency, we know that you will have decreased immune response. This talks a little bit more about type 1 diabetes and vitamin D. So I found these statistics to be really interesting. Infants with high vitamin D intake during their first year of life are less likely to develop type 1 diabetes later in life. Pregnant moms with high vitamin D levels during their pregnancy are less likely to have children that would get type 1 diabetes later in life. And vitamin D can help improve insulin sensitivity and manage blood glucose in those who have type 1 diabetes. And the prevalence of vitamin D deficiency in patients with type 1 diabetes was up to 90.6%. That's huge, guys, huge. Increasing vitamin D levels from 25 to 75 results in a 60% improvement in insulin sensitivity. And so we do need more studies to clearly answer whether vitamin D supplementation could prevent or treat type 1 diabetes. However, there's a huge link here between low vitamin D levels, increased risk for diabetes, that sort of thing, okay? So I just found that research really, really interesting. We're going to be talking a little bit about Sjogren's syndrome, which is another autoimmune issue. With Sjogren's syndrome, basically you have chronic inflammations of your exocrine glands. Your exocrine glands are things that produce moisture. So most people are going to have dry, itchy eyes, a dry mouth. They'll get sore throat from that. You can also deal with other GI symptoms, fatigue, muscle weakness, neuropathy, dizziness. Basically, you know, there's a variety of different symptoms associated with it, okay? But it's just a type of autoimmune disease characterized by that inflammation to those exocrine glands. So Sjogren's and gut microbiota, with people who had Sjogren's, there's a 50% reduction in the genus Bacillobacterium. I'm sorry, I made up the pronunciation on that one. I did not make up the word. And a significant increase in potential pathogens such as Escherichia and Shigella and Enterobacter bacteria. Okay, so basically with Sjogren's, there were definitely changes in that gut microbiota that you would not see necessarily in other people who didn't have Sjogren's. And I love this quote: leaky gut syndrome is almost always associated with autoimmune disease. In fact, reversing symptoms of autoimmune disease depends on healing the lining of the gastrointestinal tract. Any other treatment is just symptom suppression. And I think, you know, everyone on this call tonight would agree with that. I mean, that concept is huge, where you really are taking control of your health and working on healing your gut and not putting a Band-Aid on things and just treating symptoms and suppressing symptoms. We're working on actually healing your gut to reverse some of these symptoms. I think that's such an awesome concept, you know, that we have the ability to do, okay? Next, we're going to talk about multiple sclerosis, which is another autoimmune illness. It affects 0.1% of the worldwide population. It affects women far more so than it affects men. However, if men get multiple sclerosis, their symptoms tend to be much more severe and they have a worse prognosis. 400,000 people in the United States have multiple sclerosis. And this is so interesting because this affects younger people. So predominantly women aged 20 through 40 is who is going to be affected. And you'll definitely see genetic risks as well, as far as another first degree relative that had MS. It's variable and unpredictable, but there can be some genetic links. And this talks about ethnicity, which basically there's higher incidence in Northern European descent, which basically like white people, Caucasian, and in the temperate climate, but the latitude gradient is decreasing. So we're seeing it more in our Northern hemisphere as opposed to Southern hemisphere. However, we're seeing more and more cases, you know, in other areas. Just over time, it's becoming more prevalent, okay? So what multiple sclerosis is, it's an autoimmune disease that affects the brain and the spinal cord, and it causes degeneration of nerves. And here's a picture of a normal nerve. You have the myelin, which is the coating of the neuron there, and you can see how basically you have a signal from the brain to the muscle fiber. And with multiple sclerosis, that myelin is damaged, and there's plaques there, and so that signal doesn't get to the muscle fiber the way that it should. You can see it's broken up and jagged, and basically that damaged myelin causes the brain not to be able to communicate with the muscle the way that it should. This talks about our gut health with multiple sclerosis patients. Basically, there were some strains of bacteria that were elevated in MS patients. There were inflammatory pathways and activation of interferon, which is an inflammatory marker, higher methane production. There's another bacteria that was found to be less abundant in MS patients, and altered T lymphocyte differentiation, which basically has to do with your immune response. So all of this is complicated like terms here, but just know the whole point of that was the fact that gut health plays a role in multiple sclerosis development, that patients with MS had different levels of their GI flora than others who didn't have MS, okay? Now we're going to be talking about inflammatory bowel disease. So this is another, can be associated with, you know, autoimmune issue. So you have your healthy GI tract, you have Crohn's disease, which there's fat wrapping around the intestines, muscle hypertrophy, which means the muscles inside the intestines are basically bigger and inflamed. You can have fissures, which are basically cracks in that muscle, and there's a cobblestone appearance of the intestinal mucosa there, okay? So there's inflammation throughout the intestines with Crohn's. With ulcerative colitis, that is one where you just have ulceration within the mucosa, and it's going to be, you know, limited to the colon itself, okay? I thought this was really, really cool. This looks at basically levels of different types of flora, different types of bacteria in the gut compared to healthy people and those with irritable bowel disease. And you can see, I'm not going to like name all these different bacteria, but you can just see the difference in the columns here, that those with irritable bowel disease had different amounts of flora than those who did not have irritable bowel disease. And same thing on the other chart. So patients with ulcerative colitis, which is a type of irritable bowel disease, you can see that their flora, the amount varies as well, to where they basically have overgrowth of bad flora. They don't have that good balance and variety that they need, okay? We're going to be talking about, this is kind of our gut-brain axis we talked about earlier. So basically how, if you have, let's start here on the right side with dysbiosis. Dysbiosis basically means unhealthy balance of gut flora in your GI tract, okay? So that's going to lead to disease, altered behavior, cognition, emotion, altered levels of inflammatory cells, and abnormal gut function, okay? And then it talks about if you have healthy gut function over here with eubiosis, that means good gut flora, you're going to be healthy, have normal behavior, cognition, emotion, healthy inflammatory cells, normal gut microbiota, and you're going to have healthy central nervous system function, okay? So it just shows that connection there. Same thing here too, where it's a two-way street how this gut-brain axis works, okay? So your microbiota, the flora in your GI tract, has an influence on your neurotransmitters, your stress, your anxiety, your mood, your behavior, okay? And then also, your brain can have an influence on the motility of your GI tract, how fast things go through it, secretions of mucosa, nutrient delivery, so basically, are you absorbing those nutrients the way that you should, and the microbial balance. So do we have a healthy balance of GI flora, okay? So you said it's bidirectional, means it goes both ways. So when you're talking basically from the gut microbiota to the brain, that has to do with the production, expression, and turnover of neurotransmitters like serotonin and GABA, protection of the intestinal barrier and the tight junction integrity, which basically means, you know, keeping things tight to where those toxins don't go through, and the mucosal immune regulation. And then the brain communicating to the gut flora can have an effect on the alteration in the mucosa and that biofilm production, motility, the intestinal permeability, and the immune function. Okay, so it's a two-way street is basically what you need to get out of that. Now we're going to be talking about some neurodegenerative issues that are also related to gut flora. So Parkinson's disease is a progressive neurodegenerative disease. Nerve cells use a brain chemical called dopamine to help control muscle movement. And people with Parkinson's occurs basically when those nerve cells that make dopamine are slowly destroyed. And without dopamine, those nerve cells cannot properly send messages, so you have loss of muscle function. So this is a picture of what that looks like. So you can see on the healthy person, you have your neurons transmitting the dopamine and the receptor cells taking all that dopamine. You can see all those little purple dots, which is the dopamine, and it's working well. And on a patient with Parkinson's, you can see our neurons here aren't putting out a lot of dopamine. So our receptor cells don't have a lot of dopamine. And so basically those muscles aren't working the way that they're supposed to. So we're going to look at how this brain-gut microbiota axis affects Parkinson's disease. There's a reduced abundance of the Prevotellinaceae bacteria and a greater abundance of the Enterobacteriaceae in Parkinson's disease patients. There are some specific pathogens that can have been shown to be triggering factors, H. pylori, and then Mycobacterium paratuberculosis. Other risk factors for Parkinson's are going to be advanced age, being male, declining estrogen levels, head trauma, low levels of B folate, and environmental toxins. Now we're going to talk about Alzheimer's. So Alzheimer's is basically classified within a larger category of dementia. It'll get worse over time. It affects your memory, thinking, and behavior. Over 5 million people in the U.S. have Alzheimer's. 1 in 9 people over the age of 65 has Alzheimer's. And 1/3 of our seniors die with Alzheimer's or another type of dementia. There is a greater prevalence in women than men. And this is a picture of how Alzheimer's works, okay? So you have your healthy neuron up here, and with Alzheimer's, you have diseased neurons. You have these amyloid plaques, and the microtubules are disintegrating. The plaques, basically, there's tangles where basically everything is degenerating, and the neurons aren't able to communicate the way that they need to, okay? I mean, you can see like the whole neuron is just unhealthy. And so you can also see on the brain, the cerebral cortex and the hippocampus, you'll see significant shrinking of the cerebral cortex and the hippocampus, and the ventricles can get very enlarged. So the brain itself just completely changes shape. It's crazy. And this also looks at basically normal neurons and how they communicate and connect. And in Alzheimer's, they have tangles and they have those plaques that disrupt that communication. And then this basically just talks about the inflammatory connection between Alzheimer's. So oxidative stress and inflammation can damage nerve cells, and loss of brain nerve cells is what causes Alzheimer's, okay? Now we're going to be talking about gut health and mental health and how that plays a role, how our gut microbiota plays a role in our mental health. And I really like this cartoon. I just thought it was cute. So it looks like the doctor confirmed my diagnosis. It's not just your bowel. Everything about you is irritable. And guys, I am sure we know people like that. And I'm sure we may have been somebody like that. And thanks to improving our gut health, may not be as irritable and moody and just feel better, right? So anyway, I just love that cartoon because it really takes that idea into a picture there. This talks about how basically your GI tract can affect that central nervous system. It's that whole gut-brain axis thing again. You can have microbiota changes that leads to gut epithelial breakdown, which means leaky gut syndrome. That's going to cause immune activations. Endotoxemia means those toxins are getting into the bloodstream. You have the inflammatory cytokine production. It's basically an immune response. A breakdown in that blood-brain barrier, so things can get to the brain when it shouldn't. Alterations in those neurotransmitter levels, changes in the synapses, which are those part of the neurons and how they communicate. Then, therefore, you're going to have neural changes and then behavioral and mood changes. Oh, and I should have started out here in the far left. So stress and diet and environmental triggers are what lead to the changes in the microbiota, okay? So it's all linked together. Basically, stress, poor diet, environmental triggers cause poor gut health, and that can lead to all of these mental health issues, okay? So this is interesting. These are just some studies with probiotics and mental health. So they looked at POMS, which is profile of mood states, and there was a study where, they gave people these different probiotics, and the bottom third of the group with their initial scores reporting feeling much happier and less depressed. And this was within, most of the studies were within like 2 to 4 weeks time of being on the probiotic where they noticed those changes. Another study showed lower serum corticotropin releasing factor and heart rate pre-surgery. So basically, they were given probiotics before their surgery, and so they were found to have less stress and anxiety before that. There was another study that looked at the Beck Anxiety Inventory, and basically people had better scores after being on the probiotic than they did before. There's decreased tension and anxiety on that POMS, the profile of mood states, and reduced self-reported cognitive reactivity to sad mood, reduced aggressive thoughts. Those were basically some studies that look at how a probiotic can affect your mental health, okay? Now we're going to talk about autism. So there's evidence that indicates that food containing casein and gluten contribute significantly to the autistic spectrum disorder. About 80% of autistic spectrum disorder patients improved following strict dietary exclusion of these substances. So casein is a protein found in milk, and gluten is a protein found in wheat, rye, barley, spelt, kamut, and commercial oats, okay? And this does not mean if you know somebody with autism, you go out and tell them to eliminate casein and gluten in their diet. It's something that they would want to discuss with their doctor, okay, and to be able to come up with a good plan for them. But yeah, there are definitely studies linking dietary triggers to autistic behaviors. And then this Feingold diet is something that has been shown to be helpful for people with autism as well. And basically you're removing harmful things like artificial food coloring, artificial flavors and fragrances, some preservatives, artificial sweeteners, and any food with the salicylate in it. They're removing those things from their diet, okay? just kind of touch on non-celiac gluten sensitivity. So there are people who are sensitive to gluten but do not have celiac disease, okay? So celiac disease is an autoimmune issue where they absolutely cannot process gluten. You can be sensitive to gluten but not have celiac disease, okay? So some people can experience symptoms found in celiac disease, such as foggy mind, depression, ADHD-like behavior, abdominal pain, bloating, diarrhea, constipation, headaches, bone or joint pain, and chronic fatigue when they have gluten in their diet. So basically, they are sensitive to gluten. That gluten seems to trigger these symptoms. However, they don't have celiac. So their research is showing that wheat exposure in this group can trigger a systemic immune reaction with accompanying intestinal cell damage, okay? So just know that there's a connection there. Does that mean that everybody needs to go out and be gluten-free? No, not necessarily, okay? I mean, it depends on the person. But it's something to talk to your doctor about if you're concerned, or if you notice, if you eat foods with gluten in it and you're having these sort of symptoms, to talk to your doctor about going on an elimination diet like that. And, you know, do you see improvement with doing that, okay? Now we're going to be talking about obesity and how that is linked to our gut health, okay? So characteristics of obesity. Obesity, you are in a state of low-grade inflammation. You have chronic inflammation throughout your entire body when you are obese. There's also definitely altered microbiota, and I'm sorry for my misspellings here, but there are different flora in the intestines of an obese person versus someone who is not obese, okay? And there's also linked to insulin resistance with obesity. So this just looks at obesity and the gut microbiota. So you can see leaner people have more variation in their microbiome than obese people. And more variation in your diet leads to more variation in the microbiome. So if you're eating a variety of good, healthy foods, you're going to have a variety of good, healthy flora in your GI tract. And if you're eating the same junk over and over again, then you're going to end up with basically a lot of the same strains of flora that are not necessarily healthy. You'll get an overgrowth of those flora, okay? This also looks at how the gut microbiota helps to harvest energy and increase host fat storage. And a dysbiotic gut, which basically means unhealthy balance of gut flora, leads to increased gut permeability, inflammation, adiposity, which is basically your fat tissue, insulin resistance, caloric intake, increased risk of obesity, and metabolic syndrome, okay? Like, that's crazy, guys. Like, your unhealthy gut flora is linked to all of those issues. Having unhealthy gut flora is leading to higher calorie intake and obesity and insulin resistance and inflammation. I mean, it's all connected, okay? So, and then I like this picture too. It just talks about how your gut microbiota can basically affect your brain, liver, the adipose tissue, the muscle, and the epithelium, which is the skin. And so you can see all of these other body systems that are being affected, okay? We're going to talk about cardiovascular disease and inflammation. So you can see here with cardiovascular disease, and you see the normal coronary artery. You have early inflammation, which is a little bit of plaque that it's forming there. And CRP, which is C-reactive protein. It's one of the markers that we check when you do blood work to check for inflammation in the body. So you'll have more CRP in the blood when you have that plaque there. And you can see with this advanced inflammation, the plaque is seeping into the artery channel, and the CRP is rising with the severity of the inflammation, okay? So of course, basically this is just showing how there's a relationship between cardiovascular disease and inflammation. And our last slide here is the big picture, how our gut affects our health, okay? So you're gonna start out here at the bottom. You have an unhealthy diet, so that gives you poor gut flora. It affects the gut the gut barrier, where you have leaky gut syndrome. With that, you can have endotoxemia, which means those toxins are getting into the body, or basically bacterial translocation, where bacteria can get into the body and into different tissues, okay? With that, you're gonna have an immune system overactivation. So your immune system is alerted that there are toxins and bacteria that's in the bloodstream where it shouldn't be. It's gotten out of the GI tract, and that leads to systemic inflammation throughout your entire body, okay? So that is it. Let me stop share and we'll go back on here. And yeah, I'm going to open it up to any questions that you guys have. Hopefully that wasn't too overwhelming, and you got a good understanding of how our body works, how our diet and our gut flora affects so much of our body, and obviously, of course, how our products can play a role in helping with that.